Welcome in, everybody. This is For Your Health, a presentation of Medica Pharmacy. If you're viewing it, good evening. It's pre-recorded in both instances. And with us this morning, Alyson Schwartz from Medica Pharmacy. Good morning, Alyson.
Good morning.
On a bright, sunny morning.
It's beautiful. It's going to be a great day today.
It is. You know, we've talked in the past, matter of fact, it came up in a conversation where somewhere I was earlier this week about how people's mental and emotional attitudes are changed by sun or lack of. Kind of talks and leads us into today's topic, and that's depression, which is nobody can be immune from it, and it can have adverse effects, a lot of adverse physiological effects on a person suffering from it.
Oh, yeah, absolutely. Depression is not just mental. It is every bit of physical disease as well. And, you got to get down to there are so many people out there with depression, and is it really depression or is there some underlying medical condition? You always hear horror stories of people that go in and they don't feel good. Maybe they feel like they get heart palpitations and they have kind of some anxiety issues and they're diagnosed with depression when sometimes they should have been diagnosed with the heart condition. So there are some unfortunate issues of the widely spread issue of depression that goes on in our country.
That is spooky to know that you can confuse things as dangerous as depression and heart issues.
Right. And, if you really look at the data that's out there, depression is really just a label that we give people that have that depressed mood most of the time. Maybe they have a loss of interest in stuff, especially, they don't get the pleasure from the activities they used to. Mm-hmm. A lot of them are tired. They don't sleep well. They no longer have interest in having sex with their husband, wife, or partner. They feel hopeless, helpless. They can't think clearly. They're confused. They have trouble making decisions. So those are all issues that get labeled as depression, but, is there something else going on? I mean, maybe the reason they can't sleep is they've been under a lot of stress, so they've had something bad happen in their life, and that's their body pushing out lots of stress hormones, and that affects your sleep. So are we really getting down to, are you depressed or is there an underlying cause? But I was just reading a few incidences of people that have gone in with heart palpitations, and you don't go in and your doctor says, well, you have angina, which is, an easy term for chest pain, and they let you go. They find out, why do you have the angina? So, there's a big push to find out, why are you depressed? Not just, here, you're depressed, let's take some medication. Let's find out why. And there's really some scary data with it. Women are at higher rates, have a higher risk of depression than men. 1 out of every 10 Americans is on an antidepressant. But what's even scarier is that 1 in 4 women 40 years of age and over are on antidepressant. And there's now starting to be data showing that antidepressants increase your risk of breast and ovarian cancer. Well, that's a pretty scary risk. It's not a risk I'm not willing to take. But I think the data that scared me the most is if you survey the people that were given antidepressants, 72% of them were given no medical workup to see if there was anything else going on with them before they were prescribed an antidepressant.
That's 3 out of 4.
Yes. And so you have all these symptoms, and so you're given an antidepressant with no medical workup. So how can you really be sure if it's depression or if there might be something else going on? And that just was alarming to me that we're really missing a big picture here. And, everybody's to blame. The drug companies are advertising antidepressants on the thing of, give you all these symptoms I just listed and saying this drug will work for you. So people do go into the doctor and request these prescriptions. But at the same rate, the insurance companies are looking for a diagnosis, and they're pushing doctors to see more and more patients. And so to really sit there and really take the time that a patient might need for you to properly diagnose them, it's really difficult. And so everybody's under the gun to just, let's just try to fix it, that sometimes we're missing what the problem really is. And but that fact alone of, you basically 3 out of 4 times aren't going to get maybe properly screened to see if something else is going on is pretty scary.
So I guess it's kind of like which came first. You can have a physical problem that can get you in a position where you can become emotionally and mentally depressed, or you can have you can have depression, which can create a physical problem.
Absolutely.
So, finding out which is first, or is treating the real problem can help both scenarios.
Oh, absolutely. And I was watching some videos and reading studies and looking at some data of some psychiatrists that really focus in on depression, and they were showing that you can take 2 people that have the exact same symptoms and you can give them the same drug, and one of them may do okay, but the other one could get dramatically worse because even though their symptoms are the same, there's, something else is going on with them. And so, every antidepressant out there has a huge black box warning that says this drug might increase your risk of suicidal thinking. And we unfortunately had a young girl who was having some stressful issues, and mom did not want her to be put on an antidepressant, but they tried some other things and nothing worked. So they put her on an antidepressant, and this is here in Bardstown. And she was recently put in the hospital for suicidal thinking. And so, it's so many adolescents, and these drugs really aren't studied very well in adolescents, but boy, sure a lot of them get them. And, adolescence is hard, and if you look at the media out there, I mean, everybody's supposed to look great and feel great, and we're all supposed to be skinny and be beautiful and have perfect skin because they airbrush everybody on TV and in magazines. That puts a lot of pressure on teenagers because teenagers don't have perfect skin. I mean, they don't. And so it's, we're not all skinny. Not everybody's skinny. And so it puts a lot of pressure on a falsehood of this is how you have to look, and it makes adolescence really hard. And, and we all know, I hate to say it, but we all know kids can be mean. Kids are mean to each other. I mean, I was a kid once, and I remember I had some really mean things said to me. I might have said mean things back. Heck, I don't know. But, I mean, it's hard. And so that's something that needs to be addressed, but antidepressants may not be the answer, especially if they're going to put your child at risk. So it's something to definitely think about. But what's, I guess, scarier to me is, and this is not just with antidepressant drugs, it's with all drugs that are studied, is anytime a drug company does any kind of study on a drug, they don't have to publish the data. They get to publish whatever study and whatever data they want to publish. And they're showing that success rates on antidepressants mean you have a 50% improvement in your symptoms, and that only happens less than 50% of the time that you're on one. So this came from the New England Journal of Medicine, which is one of the most well-respected journals out there. And they looked at 74 studies with 12 different antidepressants and about 12,000 people. And they discovered that 37 out of the 38 trials with positive results were published. But they also found that the negative studies that have negative results, only 14 out of 36 were published. But the ones that had negative results actually were skewed to show a positive outcome. So that basically means they're kind of trying to twist the data to show you that the drugs work when they really don't. And that's scary. And so, and you think, this isn't just antidepressants, this is all drugs that they can do this to. They can skew the data. And we've all known it for a long time. You can basically use whatever data you want to find some result that's a positive result. And it may not really be a positive study. And that's scary, and that's something to think about. And, we've put a lot of trust in drug companies. I don't know why. They're out there to make money, and so they're sometimes skewing the data. So that's across all the boards, but with something as serious as depression and maybe giving somebody something that's going to increase their risks of committing suicide, I think that's just wrong, and we really need to start looking better at that.
How do antidepressants work from a layman's standpoint? How would you describe, what do they do to the body and the mind?
What they're supposed to do is they are supposed to increase your antidepressant chemicals, and a lot of people know what serotonin is. Some of them work on dopamine. Dopamine's we've talked about it before, and you see somebody and you get a big hug and a congratulations, your body releases dopamine, oxytocin, that type of thing. So there's a lot of them are serotonin reuptake inhibitors. Those are the more popular ones, like Prozac and Paxil and Lexapro and Celexa, that so many people are on. So they're supposed to increase the serotonin that's in your brain. What we're finding now is that depression is not a deficiency in serotonin. Sometimes it's the fact that you have a little transporter gene that carries serotonin from neuron to neuron, and women, especially if you're deficient in B vitamins, your serotonin transporter gene is very, very small. So you can have all the serotonin in the world, but you won't transport it across the neurons correctly. So the other thing is, it's not, sometimes you have plenty of serotonin and you have other imbalances. And so when you give yourself a drug to increase your serotonin, you cause great havoc. So we see that when people take certain drugs and they're like, oh my gosh, I became so angry and anxious and moody. And well, that maybe that you have plenty of serotonin. You're just creating an imbalance further down the line that needs to be addressed.
As you mentioned earlier on, about 3 out of 4 people don't have a physical done to find out if there's an underlying issue before jumping into taking an antidepressant.
Right. And I've talked before is, the body is an amazing thing, and it can really take care of itself, but when things get out of balance, it becomes difficult. And so sometimes depression is just that. There is some underlying imbalance that we're not addressing. maybe it is that you don't sleep well, and so you're producing lots of stress hormone, which really, that stress hormone, cortisol, attaches to every hormone receptor in your body, but it especially affects your thyroid. So it keeps your thyroid from working well. Well, everybody knows if your thyroid's low, you tend to be more depressed. So maybe it's an underlying thyroid condition, but there's lots of other things. So the trick to depression is there's lots of keys that you need to kind of look at first, okay? And one of the big ones is you've got to exercise. You got to exercise. I mean, nobody wants to exercise when they're depressed. You don't feel like it, and I get that. But if you look at any antidepressant drug, all of their data says they are only effective if you are using them with talk therapy, exercise, other medical management. So, I mean, talking to a psychiatrist, how many people on an antidepressant actually see a psychiatrist? I mean, OBGYNs prescribe them, primary care physicians prescribe them, and I'm not saying that that's wrong, but I'm saying if you really think you have some depressive issues, you really need to talk to someone that specializes in that area to make sure that that really is what you have. Are you screened properly for that depression? So, exercise, talking to somebody, huge help. Try an elimination diet. You would be amazed at certain foods that cause inflammation in your body, and there is a huge push now. They're really starting to see that people with depression have inflammatory processes in their brain. And so if you can get rid of the inflammation in your brain and in your body, then you feel better, so you're not depressed. But I mean, when you think about people that, if you have ever had an injury to where you're really sore everywhere, muscles are pain, that's inflammation. You don't feel good. You do feel kind of down. So if that's a widespread kind of low-lying chronic inflammation, that really can cause a depression. So find out, the two most popular allergenic foods are wheat products and dairy products. So, eliminate wheat. Bread is so bad for you. And I know everybody loves bread. I mean, so many people love bread, but it really is toxic to your system. So, just go for, 2 weeks to 30 days. Get rid of all the pasta, breads, chips, crackers. Get rid of all the grain products and see if you don't feel better. I think you'll be amazed. And then if that doesn't make a huge difference, try getting out of the dairy. I have a good friend of mine that she used to eat yogurt every day, and it really didn't feel bad. Really didn't feel bad. So she decided to cut out the gluten and cut out the dairy, and she felt so much better. She won't touch dairy. She won't even eat cheese. And cheese may not upset her, but she feels so much night and day different that she refuses to eat anything that has dairy in it. And I mean, it made that big of a difference in her. So, give it a try. It's a quick, easy, something you can try on your own. Cut out certain foods. If you have questions, please come to Medica and talk to me about it, and I can give you some lists.
What would you replace them with, would be my question.
With milk?
Milk
or like,
and
I'm not a huge milk fan. I mean, actually, that's not true. I love milk. I don't drink it very often. But you can use almond milk. Some people do soy. I'm not a huge soy fan, but you can. Coconut milk. So if you're a big protein shake person in the morning, almond milk and coconut milk are phenomenal options to use instead of dairy.
It, but it's not a dairy milk.
It's not a dairy milk, yeah. I mean, like I tell you, we quit making the enzymes to properly break down dairy when we're young, and we're not designed to drink cow's milk. We really are. We're not cows. And so we don't have the enzymes to break it down. So, dairy, you have that child that drinks a lot of milk and they have that chronic kind of post-nasal drip and a little bit of cough. You take them away from the milk, you might be surprised if their nasal drip will go away. So it's not that far-fetched to think that if it's causing that much issues in your body, it can be contributing to your kind of low mood. Okay. Get your thyroid checked. And here's the thing about your thyroid is don't just get a TSH done. And that TSH is a really, really wide range. But really the issue you want it in is a very low range. So make sure that not only are they checking your TSH, and everybody a lot of times check your T4 because that is the most common thyroid, but your active thyroid is T3. That's not a commonly screened thyroid test, and some insurances don't want to pay for it for who knows why reason. And if you've got that high stress hormone, you can actually convert T3 back to T4. So doing a reverse T3 or checking for thyroid antibodies might be a good option as well. So make sure they're not just taking a little bitty snapshot of your thyroid. Make sure you're getting the full thyroid panel just to rule out that hypothyroidism. And keep in mind that there are things that your thyroid hormone may look fine, but it can't attach to the receptors. If your stress hormones are high, your estrogen is high, your thyroid won't attach. So you've got to really rule out that low thyroid issue. Vitamin D deficiency. We talked about that before. It's very prevalent, but it can actually lead to a little bit of depression. So make sure you're not low in vitamin D. And there's some new studies now showing that the test for the 25 hydroxy vitamin D will show that you're low. But if you don't actually do follow-up tests to the active parts of vitamin D, that you look like you're low in vitamin D and you're really not. And this is actually interesting since it is Black History Month, that African Americans are more likely to show a low 25-hydroxy vitamin D, but yet they have higher bone masses than white Americans. So that, that's something that needs to a little more looking at and figure out why that is. But I thought that was very interesting.
Have you told me before vitamin D sunlight gives us?
Yes.
Okay.
Yes. So the sun's out today. People roll up your sleeves and get. It's hard to get it when you're fully clothed. It's not going to be really warm, but it is going to be like 56. That's almost t-shirt weather to sit up there for a couple minutes and soak in some vitamin D. Not only you can't help but to smile after this god awful winter we've had when the sun's out. Another supplement that's huge, and a few psychiatrists that really specialize in this is one of the first things they'll add on, is an omega fish oil. Fatty acids are extremely important for your brain to work right, and they're extremely important for those antidepressant neurochemicals to cross the neurons. And if you're low in omega fatty acids, they won't work right. And so adding 2 to 4 grams of fish oil a day can see dramatic mood improvements. And sometimes it's not even just going from being depressed to not depressed. It's going from being just a little irritable and moody to stabilizing that mood. So, and usually the thing about fish oil, if it's a good quality fish oil product, like we recommend Eskimo 3, you can usually see a difference in a week. Like antidepressants take 4 to 6 weeks to work. If it's an omega deficiency, you might see a difference in a week. And fish oil has multiple other benefits. So if you're not on one and you're feeling a little low, it's definitely worth giving it a shot. I mentioned that women that have the short serotonin transporter gene might be low in B vitamins. And the trick with B vitamins is it has to be in balance. And specifically, it's the B6, the folic acid, and the B12. So get yourself an active B complex. The one we have has activated forms of B12 and activated forms of folic acid. Some people with a certain gene don't absorb folic acid correctly, which leads to higher risks of birth defects and multiple other things. And a lot of people can't utilize B12 in its non-active form. So make sure you're getting a really good B vitamin. It wouldn't hurt you to get checked for heavy metal toxicities. There's heavy metals everywhere. It's not very common. I don't know very many people that come out of their doctor's office saying my doctor ran a heavy metal screen on me.
Yep, that'd be the first I'd heard of.
Yeah, but high levels of mercury have been linked to depression, and and I don't know how strong the correlation is to the old mercury amalgams for your teeth. I don't know how common people have mercury toxicities, but I have seen some studies showing that they do. So, just get yourself screened for some lead and some mercury and see. And then again, exercise. Exercise is really hard to get started doing if you're not doing it. But granted, we're showing this a couple days late, but I think it's still supposed to be warm on Thursday before the storms come in. So, get out there and get some exercise. February's, a little about half over, so we're going to start to see some nicer days, and it's a perfect opportunity to take advantage of the warmer weathers and go out for a good walk.
I've just heard and seen and have family members that run a lot, and they seem to, it kind of kickstarts the rest of the body by getting that exercise. I mean, they're increasing their heart and lung, all that, they're giving those a good workout and that can't be bad for your body to increase circulation and all the cardiopulmonary.
It is, and you actually vigorous exercise actually increases the rates of absorption of your antidepressant chemicals in your brain and increases the production of them. So if you think I'm really low in serotonin, I really need some serotonin, go out for a walk or a jog. And I started running about a year and a half ago, and we all ran the Bourbon Chase last year. And when I first started running, I thought, this is ridiculous. I don't understand why people do it. But then as you kind of got into it, the farther that I got to where once I got to where I could run 2 or 3 miles at a time, it was amazing to me. Like if I just go run for half a mile, I get aggravated. But if I can run for 2 or 3 miles, man, oh man, it really does make you feel good. I mean, the energy level that you have after that bout of exercise, and that it's hard when you don't feel good and you have no energy, you don't want to exercise. But it is amazing to me that people that say, I don't want to exercise because I'm tired. And if you could just convince yourself to go get started, the amount of energy you get from that exercise is outstanding. Now, some people, if you're really adrenally fatigued and really stressed, sometimes exercise does make you more tired. Well, that means you have an underlying issue that needs to be addressed. But most of the time, you get very energized from a little, even if you can only give yourself 15 minutes, start somewhere.
You've covered a lot of ground and talked about a lot of things that people can do, and many of them are exercise, start some fish oil products if you have. These are some things that people drop the dairy in the wheat from your thing. So these are some things that you can do. But you also mentioned early on and multiple times make sure that your depression is not a physiological thing that's created depression. If you're not feeling well from a physiological standpoint, you're going to be depressed. And obviously, we've talked, if you're depressed, it's going to keep you from exercise and keep you from doing the things that will make you physically sick.
Yeah, absolutely. You know, and again, we unfortunately we live in a pill society. I mean, drug companies are creating pill after pill, and they're all over the TV. I mean, you can't watch any TV or open any magazine without seeing an ad for something that's supposed to make you float with butterflies and feel great, and water ski and all. It's ridiculous. It really is ridiculous. And so when you go in and you've got something and you're not sure what's going on, and they say, well, here, try this pill, ask why. I mean, so what's really wrong with you? Why do I need that pill? What exactly is the pill going to do to me? Well, it's going to make you feel better. Why? Why am I depressed? Why am I not sleeping? Not just here, this pill will take the pill, it'll fix you. Really get down to why is it? And if you can start getting into the why do you have these symptoms and get to the root cause, it's a heck of a lot easier to fix and a lot safer in the long run.
What else is new going on with Medica Pharmacy? Or is it, you got a robot over there? You told me that I need to come over and we need to do a show over there.
That's right. We need to come check out the robot. Okay. I'm on enough supplements. I need to package up my own supplements in the robot. But, not a lot new. The one thing it is February, which is Black History Month. So, I did a show on that a couple years ago about some of the disparities there between health. And we're still seeing those. Just kind of quick, African Americans have higher rates of heart disease and stroke, higher rates of high blood pressure, higher rates of obesity, higher rates of infant death syndrome. They are twice as many diabetics in African Americans as opposed to whites. They have lower 5-year cancer survival rates. And one that I found interesting is they have higher rates of HIV disease, but lower rates of treatment. That didn't make any sense to me. I didn't understand that. But maybe it's a socioeconomic, maybe it's a monetary issue. I'm not really sure. But, we got to figure out why do we have differences in healthcare? Why are the diseases more prevalent? And again, it goes down to be proactive with your healthcare. Find out why you have something going on. What can you do about it? And if you're not getting the answers you need, get a second opinion. If you're not happy with how your health is being managed, you're having trouble, and you want to be healthier and you're not getting the answers you're looking for, get a second opinion. Second opinions are never a bad idea, and sometimes you can really make a big difference. And don't be afraid to step outside and say, I'm not happy with that answer, and I appreciate it, and I appreciate your professional opinion, but I'm going to just get somebody else just to see if we're not missing something. But we got to figure out why there's differences in the different races and ethnicities, because we should all be able to be as healthy as the other, and we need to figure out why that is.
Alyson, thank you very much for coming in today, and this is, of course, For Your Health, and we replayed that show a few weeks ago.
Okay, great.
And at the beginning of February, and we got a chance to revisit all the things that you just kind of briefly touched on. But we certainly appreciate your concern for the people of our community, all races, all peoples of our community.
Yeah, we all need to work together as a community to be healthy, and I mean that's a big push in healthcare these days. Is so many times we've lost that human connection, and sometimes I have people, I'm like, when's the last time your doctor actually touched you when you went in? And I mean, it used to be your doctor would poke and prod and feel all over you, and so many times you have patients that are like, I can't remember last time my physician or my nurse practitioner actually touched me. And touch goes a long way in communicating compassion, and Lord knows we need more compassion in this world. So if we work together and support each other, I think we'll be healthier in the long run.
Thank you very much. She summed it all up. Medica Pharmacy with 2 locations, just up the street from where we are here in Bardstown and up in Shepherdsville, Kentucky. And people can reach Medica Pharmacy physically, walking in, via Facebook, via just about any way in the world.
Yeah, website, LinkedIn, Foursquare, you name it. But yeah, Facebook, we're very active on. Website, send us an email, stop in, give us a call.
And these shows are up on your website and your YouTube channel.
Yes.
For people to watch at their convenience. That's For Your Health today.